This unassuming office building in Sydney's north is the unlikely front line of the battle against the spread of COVID-19.
So when were you notified that you had your positive test?
These are the contact tracers, one of a number of specialist teams across Australia that are working to break the chains of coronavirus transmission.
So in regards to symptoms, have you had any symptoms since that flight?
The teams are made up of an army of health workers, along with serving members of the Defence Force. Here, you won't see any personal protective gear, just phones and computers.
Good morning, guys. Good morning, ma'am.
In every case of coronavirus that tests positive, they spring into action in a race against time to trace others at risk.
Without the contact tracing teams, we would be in a very different place to where we are now.
It's a real life and death job, isn't it?
It's really important. It's the people you don't see but are working around the clock to protect the community from COVID. It's such an important job.
Dr. Jeremy McAnulty is Executive Director of Health Protection in New South Wales. Contact tracers, he says, are playing a crucial role in opening societies up again.
They are having to be sleuth-like, aren't they?
We call them medical detectives, so it's piecing together information from interviews, often painstaking interviews, because what the job is to talk to patients who've been diagnosed with COVID to understand where they might have got it from, what their risk factors are, and who may be at risk from them of getting onward transmission.
Channel 9's own Richard Wilkins is back at work and relishing every day of being COVID-19 free.
Morning.
But this showbiz veteran will never forget the moment he learned from a contact tracer that he had the virus.
It was 7:37 on Sunday, March the 15th, when I was sitting at home and the phone rang, and it was Saskia from New South Wales Health who told me that I'd tested positive. I remember my hands started shaking and the enormity of the whole thing just started dawning on me. And then she said, okay, now we need to figure out who you could have potentially infected over the past week.
8 days earlier, he had been enjoying the company of Hollywood royalty. Richard, along with a select group, attended a showcase performance at the Opera House by Rita Wilson, Tom Hanks' wife.
Watched a few songs, went backstage, said hi. Great show, selfie, yay, see you later. I remember clear as a bell walking out of the Sydney Opera House down Circular Quay. There was this beautiful big cruise ship there about to sail to New Zealand the following day. There was lots of activity. It was called the Ruby Princess, as I recall. What could possibly go wrong?
That selfie taken with Rita Wilson would change everything. When she and her husband Tom Hanks announced they had the virus, Richard knew he should get a test. But having experienced no symptoms, the positive result was like a sledgehammer.
The mind just goes crazy. And you imagine your kids, your family, your colleagues at work, and you imagine a worst-case scenario where everybody you've come in contact with has got it. And that was a terrifying thought.
You said you felt embarrassed.
I felt guilty. I felt ashamed. I felt scared. I felt responsible to my family, and then the ripple effect kind of kicked in. All the people that I had to remember that I'd become in contact with.
But it was the realisation that his diagnosis could crush his son Christian's dreams of TV stardom that was particularly devastating.
Christian was dancing on Dancing with the Stars, and I was so proud of him. And the thought that I was going to have to call him and tell him that his dad was crook and that he couldn't come home and that he may have it. I was trying to get through to him, and his phone was all jammed up, And then he called me, and he was angry at me. He said, "Why couldn't you tell me before some publicist had to tell me?" I said, "I'm sorry, I've been trying to call you." And then, oh God. We cried for a while and decided that we'd figure it out and that it would all be okay. But in my heart, I didn't know that it was going to be okay.
That's the terribleness of something that you can't see, you don't feel, and we don't, at that time, we didn't know enough about.
Well, we still don't know enough about it.
When you started, how many people were on the team?
We turned up and there was just three of us on the team to begin with, and as the virus spread, that had to surge to, we got up to about 150 people during that time in just about a few weeks.
Wow. And I guess the ambition is?
Back to 3 or less, hopefully.
Timmy Lockwood is a team leader with the contact tracers, tasked with the painstaking work of tracking down those who have been in contact with COVID-positive patients.
I think the Prime Minister called tracking teams the army of Sherlock Holmes. Do you feel a bit like Sherlock Holmes?
Some of our work is Sherlock Holmes-like when we're interviewing cases and finding out where people have been. It can be extremely complex, and so one case can have well over 100 contacts.
Before you pick up the phone, do you have a little moment?
Definitely.
And when you speak to them that first time, can you get a sense of how they're feeling?
Some people may already be aware through the sort of social grapevine that there was a case where they work or somewhere where they live. Other times we might be the person initially telling them and they'll sort of get a shot of adrenaline, and so their responses to questions can be very variable from, who was I in contact with, or how did you get my number? Is this a scam call?
People will say they felt embarrassed. They felt
it is.
terrible.
I think that's just humanity, right? We just don't want bad things to happen, and we don't want to be a part of bad things. So we judge ourselves unfairly. It's a weird, illogical thing we do as humans.
Timmy Lockwood and his team are now able to harness cutting-edge science to help prevent the spread of the virus. Dr. Rebecca Rockett is a senior scientist with New South Wales Health Pathology. She leads a genome sequencing team which is doing COVID-19 detective work on a truly molecular level.
So we're determining the genetic fingerprint of coronavirus, and we can use that fingerprint to look at how the virus is spreading in the population.
Like every living thing, COVID-19 has a genome, a complete set of genetic instructions. And like a fingerprint, scientists can identify tiny variations between different cases of the virus.
This is the primary sequencer we use, so this is actually what collects the genome fingerprint.
Dr. Rockett and her team are able to pinpoint where in the world a particular infection has originated from, or whether it's part of a cluster. This remarkable insight into how the virus spreads also offers a powerful weapon to help defeat it.
We really work in parallel with contract tracers, and what this information is being used for is to cluster cases together and to understand who gave the virus to who, or whether we've shut down that cluster, we've eradicated it, we haven't seen any more cases.
So you're actually able to see that that version has been shut down.
Yes, we're very happy when we see that.
It allows us to put together the pieces of the puzzle about how the virus has spread through the community, and that information is very powerful in terms of decision making around our public health actions.
Do you think we'll win this battle?
Sincerely hope so. I think things are going very well.
I presume you look forward to the day that you don't have this job.
Yes, I can't wait to get myself out of this job. Not because I don't like it, but just because I want success, yes.
A little bit down in the dumps, as you would expect. Clearly, I can't come back to work just yet. I just realised I'm wearing the same clothes as yesterday.
So you kept a diary?
This was my life. This was me sitting right here for 19, 20 days.
Richard Wilkins' experience with COVID-19 caused him enormous heartache. But after his time in quarantine, he escaped without any symptoms and not having infected anyone else.
Coronavirus out of here. I've been cleared to return to work. Woohoo.
Richard now has a profound respect for the health workers who helped him through.
I have nothing but praise for the way they handled my case.
They look forward to calling no one, they say.
Hallelujah to that.
That will be the day when there's no need to call, pick up the phone and call anyone.
No new cases today. Yippee-ki-yay.
Hello, I'm Liz Hayes. Thanks for watching. To keep up with the latest from 60 Minutes Australia, make sure you subscribe to our channel. You can also download the 9 Now app for full episodes and other exclusive 60 Minutes content.